Hello, everyone, and welcome to this audio podcast. This audio podcast as part of a quantum edition. This audio podcast as part of a Labostix sequence. This audio podcast as part of a vortex gauntlet. This audio podcast as part of the abstracts, and this audio podcast as part of a Storm Labostix production. Through this audio podcast, audio podcast today, I look at an abstract from in around 2022, and looking at abstracts as part of an overview of health inequalities, and looking at kidney care for all in support of World Kidney Day, and in support of World Kidney Day. The work had formed the peer review publication as part of sort of an advocacy publication in a medical and scientific journal in around 2022, and where there was collaboration between leads between the two social media platforms, the Renal Patient Support Group, the RPSG, and the Kidney Disease and Renal Support Group, or KDARS, group for kids. The abstract is as thus. So in the United Kingdom, unfortunately, one of the main issues surrounding healthcare is that patients or recipients with chronic illnesses like chronic kidney disease are restricted or can be restricted to National Health Service healthcare services, and approaching healthcare and in approaching healthcare service providers. Further complications can arise, especially for those who have healthcare challenges, and where misinformation can lead to fragility and health inequalities. Patient and public involvement (PPI) can help bridge some of the issues surrounding health inequalities. As part of the aims and objectives of this, as part of this abstract, to identify, number one, whether recipients or patients with chronic kidney disease would approach healthcare professionals and recipients or patients through online consultations, and through online consultations, and thus prompting collaborative efforts. And number two, to understand if and whether CKD recipients or patients would welcome more integrative support from healthcare service providers through social media, wherein patients and professionals can bridge gaps across health inequalities. As part of the methodology, in support of World Kidney Day, in support of World Kidney Day, 2022, the publication and the works sought to highlight how health inequality can be bridged through online spaces, and integrated practices between healthcare service users and healthcare service providers. As part of this sort of discussion and conclusions, patients or recipients are sort of intermediaries between healthcare sectors, primary and secondary. CKD patients or recipients also have more opportunities to share lived experiences, owing to the nature and implementation of social media platforms like the Renal Patient Support Group, the RPSG, and the Kidney Disease and Renal Support Group, or KDARS, group for kids. And part of the conclusion, so in addition to sharing lived experiences, this prompts healthcare service users or recipients to be more than mere sort of recipients of healthcare. CKD recipients become more empowered, so that more informed CKD patients become more empowered so that more informed decisions can be made. As part of the sort of summary, educational intercessions are required generally to offset issues where there are inequalities, but also to ensure excellence in health practice. That draws this audio podcast to a close. This audio podcast as part of a quantum edition. This audio podcast as part of a Labostix sequence. This audio podcast as part of a vortex gauntlet. This audio podcast as part of the abstracts, and this audio podcast as part of a Storm Labostix production.